So again, my name is Jason Roostaeian. I'm on staff at UCLA in the Plastic Surgery Division, and going to talk to you about modern approach to facial rejuvenation. Want to talk to you about the facial aging process, again, non-surgical options, surgical options, some of the latest advances that we were just talking about, and some of the common myths. I kind of want to end on that because there's a lot of misconceptions out there that people hear about. There's a lot of marketing and gimmicks out there. So let's try to cover that and get those answered for you. So what happens when we age? So the aging process really goes all the way from skin down to bone. In your skin, you see a loss of collagen, which thins the skin. You lose some thickness. You also see loss of elastin, which gives you the nice pliability of skin and that ability for it to expand and bounce back. Then, the next layer down, deep to the skin, you have the facial fat, and you have really both a loss mostly of facial fat, especially in the upper face, and redistribution, where you kind of get more heaviness down in the jawline area and the neck. And then part of that is also gravity. Over time, you lose some ligamental support for these structures, and you get a little bit of drooping and the downward pull of gravity. And then even the bone structure changes. You lose bony support for all these structures. So a lot of these things that are deeper to the skin, require surgical manipulation to restore them. So this is just a diagram to kind of show the things I'm talking about. What's the main thing? And just to ask you guys, what do you guys, when you look at the youthful face on the right versus the aged face on the left, what's the main thing you notice? Any one thing that you feel like is a common? The eyelid? Okay. Yeah, so the eyelid, that's usually the first place people see aging, and when we talk with people, we're usually looking at them and at their eyes, and when you look in the mirror, you're looking often at people's eyes first, and that's where patients often complain about the signs of aging first. So that's a good observation there. But another big common theme when you look at the youthful face, there's a smoothness to it. This line, sorry about that. This laser pointer is, okay, there it is. So this line, there's a smoothness to this line when you compare it to this line here. There's a lot of irregularities, and a lot of this is just lights and shadows. There's convexity and smoothness and youth that you lose with aging, and a lot of that has to do with things at the surface with the skin and fine wrinkles, but then things deep to the skin with a lack of that facial fat, for instance, that gives you that nice smooth convexity, and you get atrophy, and you could start noticing the bone structures beneath, and you see things like around the eye here, you have the tear trough here, another common sign of aging around the eyes is lateral hooding here, excess skin in the upper lid. You lose that smooth, nice curve that your eye wants to follow. And then, again, the cheek pad falls a little bit and loses volume there. And then you get what's called jowls here down in the neck, and then also the neck, you have excess skin laxity and platysmal banding in the neck. So what can we do about this? So there's both non-surgical options and surgical options. And so the pros and cons. So non-surgical options, less downtime generally, less expensive per treatment, but keep in mind they require maintenance. Usually you have to do multiple treatments, so sometimes it can add up to close to surgical levels. They're often limited results. There's only so much you can do with these non-surgical options. A lot of them tend to be temporary, not permanent fixes, and again, that has to do with the maintenance. They do generally tend to be lower risk compared to surgery at least, but they're often not always a solution. For instance, if you have a wrinkle down in the lower face where, with aging, like I said, you have more fullness down the lower face compared to the upper face from the effects of gravity and the redistribution of fat, that's not a great solution to try to give you a smoother contour in there. You're just adding volume down where you don't want it instead of up here where you want it. So keep that in mind. Of course, with surgical options, it has the more downtime. It's a one-time large investment, but I think in a lot of cases a better investment. It doesn't require maintenance. It kind of sets back the clock, and then the clock always moves forward, but at least you always gain the 10 years or whatever it is. And the results tend to be more significant and something you can really appreciate. So, of course, we never want to look done. And these are a lot of examples of people that look done. And this is people's fear. They say, oh, you're a plastic surgeon. It's like, oh, I never want that facelift look. But you only notice bad plastic surgery. Natural results, you don't notice them. It's invisible, and that's how really I feel like every result really should be natural. And you shouldn't change the way that someone looks. You should just turn back the clock. And communication is key. There's not one operation for every patient. You have to have the conversation, see what you're trying to achieve, and whether I can deliver that, or whoever your surgeon is, whether they're able to deliver that. And then you want to maintain healthy habits. You want to, you're putting in this investment going under surgery, and then you want to maintain that.
I wish I did one before this one.
Huh?
Yes, you want to over questions, please?
Yeah, sure. Yeah. So that's not what we're going for. So I'm going to talk more about non-surgical options now. So just starting with Botox, this is very common procedure that a lot of different doctors are doing these days. It's naturally derived. It's FDA approved as an injectable, and it's been used clinically since 1980. So we have many years of experience with it, and it's very low risk. It basically works by softening and really decreasing your muscular activity of the face, and a lot of the wrinkles on your face are formed by that repetitive muscular action. So I think it has a great, for the younger patients even, seeing younger patients, I think it does have a preventative effect. And then for older patients too, it does soften those, what we call dynamic wrinkles. So wrinkles that you get when you activate that muscle. So any wrinkles that you have that are there at rest, it won't do as well of a job for. So that's something to keep in mind. A lot of people want to know what the general cost of it is. It's from $10 to $20 per unit, and generally when it's cheaper, it's not being done by an MD. I can tell you in our clinic, it's $15 a unit, and that really doesn't mean anything to people, so I have to tell you by region. For instance, if you just wanted to do the crow's feet, that's about 8 units total for both sides. A whole forehead tends to be closer to like 20 units, so you can do the math, but it runs anywhere from, for the eyes, around 120, forehead about $300 for the treatment. So this is just a diagram to show how and why it works. Again, on the far left, you can see the kind of a cartoon of what's called the frontalis muscle, and that muscle causes the transverse wrinkles in your forehead that you can see right here. And then when you give Botox, this is an after result, you get that smoothing effect. Same thing, these are we call the levins, and they're caused by muscles here in the eye called the corrugators. Again, you get a nice smoothing effect. So I think it's very effective, I think it's very safe. It's something I use a lot in my practice, something to consider. So some of the top questions I get regarding Botox is when will I see the results? It's not immediate. It takes about 3 to 4 days to even start. So when you leave the office, you're still going to be able to use all your same muscles. And the full result usually takes about 2 weeks. And then it lasts about 3 to 4 months. So if you wanted it year-round, which you don't have to do, it's at least about 3 treatments per year. Downtime, there really isn't much. I mean, you can have some mild bruising, that's the main thing, but there really isn't any downtime. And it doesn't, as I said, eliminate all wrinkles. It eliminates the dynamic wrinkles, the wrinkles that you get from facial expression. So this is just a quick before and after. So fillers, they're injectable substance that we use to add volume under the skin. They're used to smooth depressions. And there's really 2 classes. They could be permanent or non-permanent. The most common one used is hyaluronic acid, which is a non-permanent version of a filler, and the safest really. It's the one I think most practitioners use. The best part about it, it's reversible. You can actually, if you happen to not like it, and now this is pretty rare, I've probably only done it once, but if somebody doesn't like what the filler created, then you can reverse it with a reversal agent. And that's, I think, a huge advantage. The permanent ones have really fallen out of favor, you know, for most practitioners, and they're not using it as much because there have been some issues. Some people aren't happy with it, for instance, or there can, you know, you can, with any filler, the main downside is there's potential for palpability, that irregularness of that can be both visible or palpable. Now, with good technique, it's rarely visible, very rarely. So, you know, I think it's a great option. You know, where it's used in descending order. Sorry about that. This is where it's used most common here, the nasolabial folds, the smile lines. Second to that is probably the cheeks up here, and then the lips. The lower eyelids, that's really thin skin, so your chance of having a little irregularity there or something you're unhappy with is a little bit higher there, and the bruising tends to be worse. And I even sometimes use it along the jawline, but I don't like to do that because it kind of goes against, I think, you know, surgery is a much better option for that. So the treatment cost is about anywhere from $500 to $1,000 per cc, depending on the product. So when do you see the results? Immediately. How long do they last? They last longer than Botox, from 6 months to 2 years, depending on the product. And the downtime is pretty minimal. It's just some bruising, swelling in terms of downtime, but the main thing is that either if you have an irregularity that you're unhappy with, but that's pretty rare too. I rarely have patients unhappy with the results, depending on the area. Here's some before and afters of what we can accomplish with fillers. And then here's the lips, kind of with more and more filler being used. This is pretty natural result, I think. And then there's a new one that was just FDA approved called VOLUMA, just about a year ago. And this one's been really great for the cheeks. It's the only one that lasts 2 years. It is hyaluronic acid based, so it's reversible. And it's a little bit more expensive. It's about $1,000 for the CC, but usually with 1 cc you could get nice cheek enhancement, and you could kind of appreciate that here, where you get, you know, more of a shadowing below the cheek by adding volume right there. Which is a nice effect.
Is that both sides?
Yeah, you would use it on both sides. 1 cc is usually enough. Some patients really love it and they decide to get a 2nd cc. But I honestly can't think, this is one of the fillers that I would say almost 100% of my patients have been happy with. So skin resurfacing. So skin is obviously a very important component of the aging process, and a lot of people are unhappy with their fine lines and wrinkles and the texture and the color of their skin, and that's where the different skin resurfacing options play in. And they're honestly all really the same. You know, between the 3 options are chemical peels, lasers, and dermabrasion. So chemical peels, and the whole concept is that we're literally basically burning the skin and causing an inflammatory response in new collagen formation that then smooths the skin. So there's no quick fix with this. They all have the same downtime, and which is significant. It's about weeks, where you're at first you remove the outer layer of the skin and it's really red and inflamed, and it takes a good week to 2 for the skin to even reform, so then you can start wearing at least makeup at that point. And then to get the full result, it takes about 6 weeks or so. You know, they're all pretty similar. Personally, you know, I think the chemical peels and laser treatment are great if you're getting for the full face, and dermabrasion I really like for the perioral wrinkles. I think I have a couple of examples here. This is TCA peel, and you know, it can have a dramatic effect. It works better in lighter skinned people. You have issues with hypopigmentation, unfortunately, in patients with more color. And if you do have more color, you definitely want to pre-treat with some hydroquinone.
Is that the acid?
That one's, yeah, TCA is the acid peel. That's correct. And you know, you could expect a similar result from laser. There's really no difference between the two. Just depends on which one the practitioner prefers to use. I use TCA peel personally, and you know, some people like the laser. laser is a lot more expensive. But the end result is very similar, not identical. And then dermabrasion, I think, is great for the perioral wrinkles. So just some things to consider. You know, again, with the minimally invasive options, you have a lot of different doctors, you know, marketing that, and so, you know, in this case, it's even a dentist here offering the Botox. So, you know, if you see an amazing deal, sometimes it is too good to be true, and so you just want to be mindful that they're actually using the Botox brand from the US and FDA approved, because a lot of people are using things manufactured elsewhere and of unknown consistency. And you even hear stories of people adding saline and not giving the full Botox. So it's really cheap. You gotta question it. And who's going to be doing the injections? Obviously, when you get a doctor injector versus a nurse, then that, you know, there's a cost difference there. And I think it's always good to read reviews. So moving on to the surgical options. So I'm just going to go kind of from top to bottom. The brow lift, which is basically surgically elevating the brow line. And a lot of times we can also alter the muscles that we use Botox mostly to paralyze here in the middle of the forehead. You know, this right here, lateral hooding, is a usual complaint that people have, and a lot of people think that it's their eyelid skin that is the problem, and they're like, oh, I need to remove all that upper eyelid skin. But what that does is actually, if you remove that skin here for the eyelid, and a lot of the doctors will do that, but it will drop this lateral brow even lower. So really the fix is to move the brow up, and that gets rid of that hanging skin on the side. Now this patient at the same time will also need an upper lid blepharoplasty, which is removing that excess skin from here. But her best treatment will be with both the brow lift and the upper bleph. And the great thing is the incisions are hidden in the scalp, so there's really no visible incisions, assuming you have hair, which can be an issue in some men. You know, that's a huge benefit for that surgery. It is done under general anesthesia, but if you've done alone, it is outpatient. In terms of recovery and downtime, you definitely can expect some bruising for the first week or so to 2, and then the swelling lasts about 4 to 6 weeks. And that's really going to be the story for almost any surgical procedure that I'm talking about on the face. So here's a before and after. Now this patient only had a brow lift, actually. She didn't even have the upper lids done as well, and you can really appreciate the power of the brow lift here. You can see all that lateral hooding here, and you know, a much nicer contour and better position of her brow. She also had a facelift that you can see here, but I think that this emphasizes the brow well. Really opens up the eyes. So moving down, the upper lid blepharoplasty is really meant to remove the excess skin here of the upper lid, mostly medial, from here to there. Again, it really does open up the eyes. This can even, you know, in severe cases, some people even have visual field obstruction. The skin hangs so much that it blocks their vision. And in those cases, it could even be done under insurance. This is the one facial aesthetic surgery that I'm willing to do just under local in our clinic, which makes it a lot cheaper for the patient because you don't have to pay for the operating room or the anesthesiologist, which is nice. It tends to be a pretty quick recovery. Again, the same thing, to have the bruising, the swelling, but this is a 1-week post-op result. You know, so you know, I think it looks presentable already at a week. And you know, he didn't have a brow lift. This is you know, so that would have been maybe slightly better out there with a brow lift, but he's a man, and it's, you know, you don't need the brows very high in a male. Some other before and afters of upper lid blepharoplasty, 1 female, 1 male. So now moving on to the lower lid, you know, that's another common complaint of people, is having that tear trough appearance and excess skin of the lower lid. This is called the tear trough here, and what we call the bags under the eyes. And you know, the lower lid blepharoplasty really wants to address those two things. And it really has to be individualized. Some patients are younger and just have the bags, and in those cases you can often do it without any external incision, everything within the eye, and just remove that excess fat and give them a great result. I'm going to show you one of those in a second. And otherwise, some patients do have excess skin as well, like this patient, that they need to have that tightened as well and some of that excess skin removed. This we tend to do require operating room general anesthesia. You're working too close to the eye to have somebody awake for that. So here's an example of a patient, you know, just had that excess lid fat, and you know, everything was done through internally within the eyelid and to remove that excess fat in this case versus this one. But I do have to say that the lid, both the upper and lower lid, they're very privileged in terms of their scarring. There is an external scar here, but when things are healed, I mean, you can't see it. You have to, even with the magnifying glass, you can't see it because it just scars so well. It's the thinnest and best scarring skin in our body. So that's a huge upside. It's another example. This is just 2 weeks post-op. It's just the upper lid and lower lid blepharoplasty. You can see just improvement in this area here for her, and then you know, again, the tear troughs improved as well for her. Another male patient just cleans up the eyelids a little bit, getting rid of this excess skin here, and you know, his tear trough is all the way down here, and we're able to move it up in a more youthful position, and down here and get it up to there. But you know, still not looking done. So face and neck lift. So in this, we're really trying to reposition both facial and neck soft tissues and muscles. So it's not just skin excess. Of course, we do want to remove any of the skin excess as well, but a good facelift will address a lot of the soft tissues of your face that have descended with gravity. So it will elevate the cheek, soften the smile lines, improve the jawline, improve the neckline. Again, not too different, a little bit more recovery and downtime. I would say about 6 weeks for swelling. A lot of people actually like their swollen look more than when they lose their swelling, to be honest. Because again, you get that nice fullness, youthful fullness from it. So you could take that for what it's worth. But I'd say most people are cocktail party ready at 4 to 6 weeks. Again, all the incisions this is a diagram showing where the incisions generally go. We really follow, you know, the hair and then the natural creases of your ear, where they can be very difficult to see even up close. And this is an example of a patient 10 days out. Of course, she is wearing makeup here to cover any bruising that she had, but I would say, you know, that's on the early end of the spectrum of being cocktail party ready, but she was able to pull it off. You know, got nicer jawline and neckline. And she's an interesting case because she had actually a prior facelift, and you know, I'm not very happy with that incision there. So you know, I like to really follow the crease line. I think it makes it a lot harder to see, and this is just 10 days out, so I think that makes a dramatic difference. That's a poorly done scar, in my opinion.
So the scar is pulled in perspective?
Yeah, it's following the natural ear crease better. This is too far anterior for me, and also it's white. It shouldn't be. That means usually when somebody has a bad facelift scar, it was done. They use the skin to tighten. What I do is I tighten all the tissues below the skin, and then I just get rid of all the excess skin. Scars do not do well under tension. They become white and then look like that. So that's the key to having a great scar, is to take tension off it.
You were able to cut off that white?
Yeah, because I removed a lot more skin than that. Yeah. And by manipulating the deep tissues, that's where the tension is, and then you can get a great scar. You just have to remove the excess skin, but it should never be under tension. Old facelifts, the pulled look, the fish mouthing, everything is from trying to pull the skin as tight as possible. You got terrible scars and a very unnatural look.
So when you say underlying tissues, are you talking about muscle too, or just?
Mm-hmm. Well, it's something called the SMAS.
Questions in the
I'm sorry. Okay.
Please,
Yeah.
thank you so much.
So yes, it's basically a fascial muscle system that your facial fat attaches to. Here's some more before and afters. This patient has a really full neck, and it's a nice example because you can see she has these moles here; they're all gone. That's how much skin we had to remove on her, and give her a much better neckline definition. And obviously, she had a lot of fat as well. This was all surgically removed to be able to accomplish that. This patient you saw earlier, again, just relatively younger patient, didn't want a lot of changes, but just cleaning up the jawline again in the neck. Still again, I think a very natural looking result. This patient had lost a lot of weight, and this is another patients that we commonly see that they lost so much weight that they're left with a lot of excess skin, and you can kind of appreciate that here. So we're able to give her a much nicer neckline back. And then I love this example. I mean, she's one of the older patients, kind of for what we're used to. But you can see, she had no laser peel or anything. She just had the facelift, no chemical peel. And look at the effect on the skin. This is something that there's not been a lot of research on, but we see very commonly that the effect of the surgery itself, just like the laser and the chemical peels work on the surface. I think on the deep side, when we do all the surgery, elevating the skin, it causes a smoothing effect of the skin itself as well, and gets you a much better result. And I think it's a great example of that.
Can you go back about 3 slides? One more. Yeah.
Can we use a little bit slower on the corner?
Thank you.
No problem. Okay. Yeah, if you need me to slow down, I'm happy to. So I think, and then here's another patient, again, very full face and able to, remove a lot of that excess fat and really change this can only be done through surgery. That new injectable substance can never accomplish this much of a change. Because again, remember, you have all that excess skin and all those deeper structures that need to be manipulated too, that these minimally invasive options can't get to, essentially. Another common place that we see aging is in the nose. You get a drooping of the tip, as you can see here, and that's another place that a lot of patients don't think about with facial aging, but it is pretty common. So, just with the rhinoplasty, we can reshape the nose, and the incisions are hidden mostly in the nose in most cases. If anything, sometimes we have to do a small incision here at that skin bridge. This is just an example of a male who had a prior facelift, but was still, just not happy completely with his result, and just by doing the rhinoplasty portion, I think gave him a much better, more youthful appearance. So, latest advances, we kind of already gone through this. Actually, no, we didn't go through this one. So I'd say most in plastic surgery, there's been a lot of research, and this is just some of the research I've been involved with, but with fat grafting essentially. So like I was talking about, that there's loss of facial fat is a big component of aging that we've started to appreciate in the last decade, and we've been doing a lot of research on trying to replace that with fat grafting methods. And it's kind of a lift and fill concept. Before, when we were just trying to fight gravity, we're also trying to restore volume now more, and it's pretty the potential downsides with it, it's because it's from a surgical standpoint of minimal morbidity. We take a little bit of fat from your belly or wherever you want, essentially. Usually most people request the belly or the inner thighs, and then we use that to add volume to the face. The one downside, it doesn't have predictability in terms of how much will survive. I mean, it does and it doesn't. So it's, we say generally about 50 to 60% of it survives. So you're going to lose some of it, and then it does become a little more difficult to, with 100% certainty, tell you all of how much of it's going to survive, number one, and whether one side more of it survives than the other. And that's the only thing that we don't like about it. But it's very easy to touch up then. So I think all in all, it's been a very effective tool that a lot of people are happy with, a lot of our patients. And By itself, it tends to be, I'd say, around like 5,000 or so. So, and it's a permanent option compared to fillers, so it is something to consider. But it again doesn't address the excess skin and everything else. So I find that we use it mostly in conjunction with our facelifts and everything else. But there is the patient that doesn't have a lot of excess skin, just has fat atrophy, that this is a great procedure for. Has you're gonna have the same, you're gonna have some bruising and swelling, but in terms of risk, it's pretty low risk. Then the one we talked about a lot already is Kybella. It's by a company called Kythera, and they just, I think a week ago, got FDA approved. They did the clinical trial on about 1,000 patients, and this is just one of the patients from that trial. It's not available to any doctors yet, sorry, but it should be by this summer. And I think, I'm interested to see what it does and how effective it is. The results seem promising, at least for these type of patients where they have just a little bit of excess fat and they have pretty good skin tone. I think that's the ideal patient. And it's supposed to cost about $2,000, so it's not the cheapest, but not the most expensive. So some of the common myths that we hear. So the non-surgical facelift. So there's something called thermage. Have you guys ever heard of that? So a lot of people are trying to use, just like we're using heat energy with lasers and everything else, they're trying to go deeper to the skin to cause a tightening effect. And the results are very mild. I mean, this is a marketing. This is not a patient of mine. This is like a marketing of thermage, and I mean, you gotta like convince yourself to see the result. One of my mentors that I work with in Dallas did the research on it, and that was his takeaway, that it's a very modest result, and he wasn't too thrilled with it. So you can't go in with high expectation. Does it work? Yes, somewhat. I mean, you can convince yourself that there's a little bit of a result there, but when you kind of weigh in the how much of a result you're getting and the cost, I don't think it makes a lot of sense. Then there's the mini facelift or lunchtime facelift. I mean, there's a mini lift equals mini results. Honestly, there's no real shortcuts. Biology is biology. Surgery is surgery, and if they're doing it in an hour, you're not getting much done. Yeah, there's also the lifestyle lift. I think they just went out of business, actually. They had a lot of unhappy patients, so I don't think that even exists anymore. But a lot of people still probably use that term and equate it to like a cheaper, quicker facelift. But
Is it cheaper? All the questions, please. Thank you.
I'm pretty much done. This is the last slide, so I'm gonna get right there. So again, people who say there's no downtime, that means really nothing's been done. So there's no, you can't change biology. There's no miracles out there. And everyone loves the word laser. It's high-tech, better solution. It's just heat energy. There's nothing else special about it. Whether it's chemical energy with the acid or heat energy, it has the same end effect. So don't necessarily pay more just because it sounds high-tech. All right, I think that's it. So we can go on to questions. I know we have a few.
I have